Hello, my name is Svetlana Artemova. I am a research engineer in Grenoble Alpes University Hospital, France, and I will be presenting a poster, COVID-19 Geographical Maps and Clinical Data Warehouse PREDIMED. I would like to thank all the authors of this poster for the opportunity to present our work today. For over a year now, we live in the context of COVID-19 pandemic. Still, daily monitoring of COVID-19 cases remains a significant challenge, both for hospitals and city administrations all over the world. Indeed, important decisions are to be taken according to this monitoring, and these decisions vary from bed reallocations and personnel rotation in hospitals to full agglomeration lockdowns. Local level of data is necessary to better understand the pandemic's dynamics and make more reliable predictions. The most relevant and simple local data necessary for the analysis are patients' addresses and laboratory test results, including PCR tests. In Grenoble Alpes University Hospital, patients' addresses and laboratory test results, among other data, are accessible through its clinical data warehouse PREDIMED, regrouping data produced by numerous professional software used daily in the hospital. PREDIMED contains information about patients, their diagnosis, laboratory tests, drug prescriptions, medical images, medical procedures, including surgeries, etc. This data is collected to be reused for research, patient care improvement, and institutional management. Collecting data in PREDIMED was authorized by French GDPR authority in October 2019. To monitor COVID-19 cases with PREDIMED data, three main use cases were identified by the decision makers in Grenoble. The first and the second use cases consist in early detection of clusters and close surveillance of severe COVID-19 forms through daily monitoring of home addresses of, respectively, people hospitalized with COVID-19 and people tested in the hospital laboratory for COVID-19. The third use case represents detection of neighborhoods with the most emerging COVID-19 cases to adapt local prevention and information policies and define target populations for some specific actions. Let's now look closer at the first use case. For the first use case of hospitalized COVID-19 patients, our daily cohort is based on two main sources. The daily list of hospitalized COVID-19 patients, manually produced as a compilation of information sent by all medical units. And this list is combined with patients' addresses located via a geocoding service provided by the French government. For the purpose of data confidentiality and to avoid direct re-identification of patients, geographical points corresponding to patients' precise addresses were blurred in the visualization tool by adding random weights on latitude and longitude. For the first use case, maps, as shown on the next slide, were produced twice a week. As a result, we observed the origin of the hospitalized COVID-19 patients for the last 4 weeks, color-coded by the hospitalization date. Thus, the origin of severe COVID-19 forms could be monitored. On this map, you can see the COVID-19 hospitalizations for 4 weeks preceding April the 19th, 2021. Hospitalizations less than 1 week are colored in red. Those with the entry date between 1 and 2 weeks before are in yellow, between 2 and 3 weeks in green, and those between 3 and 4 weeks in blue. Let us now look at the second use case. For the second use case, monitoring of people tested for COVID-19 in our hospital, we have used hospital laboratory test results. To estimate the sampling distribution in each area, we took into account both negative and positive test results because getting tested suggests having some symptoms. As in the first use case, we have also used patients' addresses located via a geocoding service provided by the French government. To avoid direct re-identification, geographical points corresponding to patients' addresses were blurred in the visualization tool by adding random weights on latitude and longitude, while precise addresses were used in cluster detection algorithms. Clusters were computed by the state-of-the-art algorithms at the district level defined by the French National Institute of Statistics and Economic Studies. For each geographical region, we consider the population according to the 2016 population census. For the second use case, maps, as shown on the next slide, were produced daily, and updated 5 times a day. The following clustering parameters were used. Analysis over a rolling period of 42 days, maximum reported diameter of 4 kilometers, maximum time window covering 17% of the study, 7 days, minimum cluster duration of 2 days, minimum number of 3 confirmed cases in a cluster. This space-time analysis helped to rapidly detect emerging clusters and declare them to regional COVID-19 crisis unit, which includes the mayor of Grenoble. On the picture, you can see the results for the second use case. Precisely, we show an episode of the second COVID-19 wave, the data for the September 25th, 2020. You can see a cluster that was detected on the university campus. Finally, let's look at the third use case, detection of neighborhoods with the most emerging cases. The maps produced for the 2 first use cases were also used for the third use case. But these maps were combined with open data available for administrative districts in France. This open data contains information about population density, demography descriptors, income, education, social vulnerability, and many others. In this presentation, we concentrate on one example, combining the COVID-19 hospitalization data with the population density. Precisely, we evaluate the match between the real-life cases distribution and the indicator of the density of population demographically vulnerable to hospitalization with COVID-19. We define this indicator as a scalar product between 2 vectors. 1, probability of a person of a certain age group to be hospitalized with COVID-19, clinical data warehouse data, and population density per age group, open data. In this picture, we illustrate the third use case, population vulnerability to hospitalization. The real-life cases distribution are shown in dots. In color code, we show our indicator of the density of population demographically vulnerable to hospitalization with COVID-19. So, we observe a good match between the real life and our indicator. As a result, data analysis of the third use case was crucial to organize massive screenings on asymptomatic population in 2 Grenoble districts. These screenings were organized in close collaboration with the Grenoble City Hall. Specific surveys were conducted on the residents to identify the most probable contamination sources. According to the MAPS analysis, the key element explaining the risk of hospitalization is the population density and not the individual risk related to age. On the other hand, social vulnerability plays an important role in the risk of developing severe forms. Finally, no impact of the education level was found. To conclude, clinical data warehouse PREDIMED allowed for reliable real-time access to information on the pandemic's progress for the hospital's crisis unit and decision makers. Prevention strategies were developed, and 2 massive population screenings were organized based on the analysis of PREDIMED data combined with the social and demographic characteristics of the population. Spatial and chronological analysis of hospital data was extremely useful, both for the hospital management and for the local authorities, which allowed for their fruitful collaboration. This work will be pursued for the nosocomial COVID-19 detection, spreading via patients, but also through caregivers. Another upcoming work is spatial analysis of variants of SARS-CoV-2, the virus responsible for COVID-19. Automatic detection of hospitalized COVID-19 patients, instead of manual gathering of information by medical units, is work in progress as well. Including air pollution data into analysis might be very interesting too. Finally, current work could easily be adapted for seasonal epidemics such as influenza. The authors thank the Numeric Services Department of Grenoble Alpes University Hospital, the CIVIC team, and the City of Grenoble. We warmly thank you for your attention. Please feel free to contact us by email.